All right, I just want to go through the 3 stretches that I want to make sure you are comfortable with pre and post release, ideally 3 weeks before the frenuloplasty, and then to continue these kind of even like 10 weeks to 3 months afterwards. So we are going to have the J sweep, the tongue pull, and the forklift. So we'll start with the tongue pull here. You're just going to have a little gauze, and you're going to take your tongue, have them stick it out, and then they're going to hold it out for like a good 20-second count, and then they can release, swallow, and if they can do that a couple of times, 3-4 times is totally fine a day. So here we go. What you're gonna feel is like resistance, and they may even feel the resistance, and that's where holding it a little bit longer is going to be nice, because you'll feel some of that like tightness, like release, like the muscles resisting being out, and then it'll give in a little bit. So and it's not like down, like up slightly. All right, so that's the tongue pull. Then we're going to do the J sweep. So on the inside of the mandible, you're going to be taking your finger and doing a J this direction, and then a J this direction. So we're going to take the finger when we go down, we pivot turn a little bit, kind of rotate our finger, and then we're going to be across the frenum, and then we're going to like stretch it away from that midline. So we're going to go down. So down, rotate, push, hold. And if you can be doing 5 on each side, and then kind of like holding for a good like 10-second count to get that little stretch in is helpful. So that's just the J sweep. Now the forklift, I usually like patients like interlacing their fingers so you get some stability. And like a forklift, you're going to be going in and then tipping up. So in this case, if you're doing it on yourself, you kind of like tip your head down a little bit, because otherwise you're going to be like way up and then tipping, and that's an awkward maneuver. So you're going to go in, kind of stick the tongue out a little bit to help get underneath that tongue, and then you're going to be tipping up. So here we go. So in and under. So went in, got the tongue up, kind of like on top of it, and then I tipped the fingers. You'll notice you'll salivate a little bit more with this. And so that are those are the 3 stretches. And then I would say for the forklift, ideally just holding it for like, if you can, 10 to 20 seconds. And I'm going to show you if you have to do it on a patient, because sometimes the parents will have to do it on their children. And so you'll give them a little packet of gauze. And so we'll start with the little tongue pull. So we're gonna hold, good. Yep, and then you just open a little bit. Yep, perfect. And so we just kind of give that a nice little hold. So that's the easiest. And then the J sweep, we'll have you turn this way here. So I'm gonna go in, curve. Now I'm gonna push that little frenum. I'm just holding this so you can see there. But then over, and then the same thing, down, rotate. Now there's the frenum. I'm going to go to the side and push it sideways. All right. So that's the J sweep. And then the forklift, you're going to go at this direction. And so we're going to go under, and then you want to stick your tongue out a little bit. And then I'm going to just kind of squeeze and stretch up. So I am doing a little bit of squeezing this way just to help kind of hold, stick that tongue out. Good. And then up. You feel that stretch? Yeah. So it's going to be kind of in that like mid to deeper area that we're getting that stretch for the forklift. Hope that helps.